Hey, you guys, welcome back for another week of topics and tips. You know, all month we've been covering our practice question series, and we will be continuing this week, today, tomorrow, and Thursday, as always. If you haven't had a moment to go check out the ones for the past couple of weeks, go ahead. We have about 6 other videos on various questions. Our first week, we did cardiology, respiratory, EENT, as well as anemia. So there's 3 videos covering those areas. Last week we hit endocrine, GI, neurology, and renal. So it's 3 videos on that. And then this week we're getting into our derm, our musculoskeletal, our psych, and our men's health. All right. So before we get into the questions, you guys, I always like to do my intro with a disclaimer. So for those of you who are familiar with me, welcome back, you guys. And for those of you who are new, hey y'all, I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I create and design these videos to help nurses and nurse practitioners to be successful on boards as well as in practice. But in medicine, there's nothing absolute. We treat people patient by patient, and you have to handle these as such. So I give you the questions to kind of gauge your knowledge and prepare you for exams and boards based on the guidelines that we are currently testing on. So that is where these will follow for the current timeline. Okay, so follow me. Let's get into the questions, you guys. Question number 1 states the nurse practitioner is explaining different dermatologic disorders to the nurse practitioner students. She is explaining a case where there was a noted pearly and waxy appearance to a small spot on the patient's arm. What diagnosis shows the nurse practitioner student's understanding? Is it A, impetigo, B, melanoma, C, squamous cell carcinoma, or D, basal cell carcinoma? All right, you guys, take a moment and tell me what you think in the comments. All right, you guys, I always tell you to read the stem of the question first so that you can ensure that you're answering what they're even asking you. All right, so STEM states what diagnosis shows the nurse practitioner student's understanding, right? So, how did this patient present? What are we even talking about? So, the nurse practitioner was explaining to the NP student about dermatologic disorders. They had to note a patient with a pearly and waxy appearance to a small area on their arm. So, what do you think of? When I tell y'all derm, one, I give you the breakdown. So, just like in my review book, I give you this chart, right? Because I think when you're studying derm, the best thing to do is know the actual dermatologic disorder. So, what is the actual disorder? Google a picture. You need to lay eyes on what that looks like. Put that in your mind so you can associate it with that. The presentation, the signs, symptoms, and then how you treat, right? So with this, and I always tell you, think if I say this, you should think that, right? So if I say pearly and waxy appearance, you should think what? Because those key identifiers is what you really need to know the basics. You need to understand the basics. You definitely have to know the other stuff, but you have to know the basics. So pearly and waxy, when you see that, hear that, or read that, you should instantly think basal cell carcinoma. That's the classic presentation, that pearly, waxy, dome shaped appearance. And the most common skin cancer is what? Basal cell carcinoma. So when I say pearly and waxy appearance, you say what? Basal cell, right? So the answer here is D. All right, sorry for my long spiel. Next question. A patient presents to the office today with complaints of pain to the inner portion of his elbow. He states that he notices more when he is golfing. The nurse practitioner explains to the NP student that this sounds like classic golfer's elbow. When discussing the actual medical diagnosis associated with the name golfer's elbow, what shows the NP student's understanding? Is it A, medial epicondylitis, B, lateral epicondylitis, C, ankylosing spondylitis, or D, De Quervain's tenosynovitis. Y'all, did I say spondylitis like 3 times? I probably did. Sorry. Let's start over. Is it A, medial epicondylitis, B, lateral epicondylitis, C, ankylosing spondylitis, or D, De Quervain's tenosynovitis? Yeah, all that. Tell me what y'all think in the comments. All right, you guys. Let's read the step of the question because I know I mixed all that up. When discussing the actual medical diagnosis associated with the name golfer's elbow, what shows the NP student's understanding? And really, that's all you need to know right there, right? It's cool that, hey, the patient presented with that inner portion of the elbow pain, stating he noticed it more when golfing, but truly they're just asking you, what is the medical diagnosis associated with that common name, right? Golfer's elbow. So what do you know about that? So I say rule out what you can rule out or stick to what you know. So medial epicondylitis. What is that? So medial, that sounds about right. Because look, and they're having pain to the inner portion. That's medial, right? The answer is A, medial epicondylitis. It's also known as golfer's elbow. Lateral, that will be the outer portion, right? So lateral epicondylitis is commonly known as the tennis elbow. And ankylosing spondylitis is referring to back pain, has nothing to do with the elbow. And D, de Quervain's tenosynovitis also has nothing to do with the elbow, right? Because remembering, de Quervain's tenosynovitis has to do with the wrist. So just that thumb and wrist region. So just go with what you know and then break down what you can. At least if you got stuck, you can kind of go from terminology with the medial and the lateral. Medial being the only thing that's in inner portion, right? All right. Question number 3. The nurse practitioner student is trying to recite the CAGE assessment to the patient regarding his history of alcoholism. What shows the NP student's understanding? Is it A, cut down, accountability, guilt, and energy? Is it B, cut down, annoyed, guilt, and eye opener? Is it C, cut down, annoyed, guilt, and energy? Or is it D, cut down, adjustment, guilt, and eye opener? Tell me what you think in the comments. All right, you guys. So the stem of the question states what shows the MP student's understanding, and it is referring to she's reciting the CAGE assessment for alcoholism with this patient. So, what is the correct acronym for the CAGE assessment when you are assessing for alcoholism in the patients? So, is it A, cut down, accountability, guilt, and energy? We know cut down is correct. Accountability, nope, that's not the A, so we can take A out. B, cut down, annoyed, guilt, and eye opener. So cut down, C is cut down. The A is annoyed, yep. G is guilt, and the E is eye opener. So B is the answer. So thinking about it, the CAGE assessment, you're asking them, hey, do you feel like you need to cut down on the amount of drinks that you have each day? A, do you get annoyed when people talk about your drinking? G, do you feel guilty or have any guilt about the amount of alcohol that you drink, consume? E, do you use alcohol as an eye opener? So the answer is B. All right, and lastly, the nurse practitioner believes that the patient has epididymitis, and she is explaining the Prince sign to the nurse practitioner student. What shows the NP student's understanding? Is it A, lifting the scrotum to assess for pain or relief of pain? A positive Prince sign is when the pain is relieved. B, lifting the scrotum to assess for pain or relief of pain. Positive Prince sign is when the pain is not relieved. C, assessment of scrotal pain by having the patient squat, or D, assessment of scrotal pain by having the patient supine and cough. Tell me what you think in the comments. All right, stem of the question states what shows the NP student's understanding. So the nurse practitioner believes the patient has epididymitis, right? And she's explaining Prince sign to the NP student. So we're trying to see if the NP student actually understands what Prince sign is, right? So is it A, lifting the scrotum to assess for pain or relief of pain, and that a positive Prince sign is when the pain is relieved? Sounds right. So what is Prince sign? Is what you're trying to think about, right? Um, so we'll hold that. B, lifting the scrotum to assess for pain or relief of pain, and the positive Prince sign is when the pain is not relieved. Okay, those two are similar. So basically, here we're trying to see if that actually is what friend sign is, and then what makes it positive or negative, right? So let's see the last two, and then we'll do that. Assessment of scrotal pain by having the patient squat. No, that's not going to give us an adequate assessment, so you can rule out C. D, assessment of scrotal pain by having the patient supine and cough. No, that's not going to give us an adequate result either. So it's between A or B. So lifting the scrotum to assess for pain or relief of pain is what friend sign is. That is how you conduct it, right? A positive friend sign is when the pain is relieved. Yes, that's correct. So classic epididymitis, you're trying to diagnose it. Lifting the scrotum and the patient says, okay, the pain is now gone when you do that. That's a positive friend sign. If lifting the scrotum and the pain does not go away, that's negative. Okay. So A is the correct answer. Lifting the scrotum to assess for the pain or relief of pain, because that's what we're trying to see. And it's positive when the pain is relieved. So when lifting the scrotum, if the pain is relieved, that's a positive friend sign. All right. All right, you guys, I hope you found this helpful. As always, like, comment, and subscribe, and be sure to share with whomever you may think may also find this beneficial. But meet me back here tomorrow for Work It Out Wednesday. You know, we always work out a practice question on Wednesdays, but we're doing it all month long. And then also on Thursday. And if you haven't had a moment, as I told you earlier, go back and check out the ones for the past couple of weeks and test your knowledge and make sure you tell me how you do. And you know, if you're struggling with anything, I always tell you guys, let me know. Reach out to me. You can email me. You can shoot me a message. You can put it in the comments. And I'm happy to go over any areas to help you um, get a better understanding and excel in these areas. But be sure y'all meet me back here. Bye, y'all.